can hear me, and if you can't hear me, I'm sure that you'll let us know on Facebook. So I guess we'll go ahead and get started. Just taking my time to answer a little bit of questions, a little bit informal. I'm here at my official residence. Have a number of things that are laid out in front of me. And different things. So I know that a number of persons sent in questions, and I'm sure that a few other people will send in a few more questions. And this is just a chance for some informal chatter, so that we can see. Still some technical difficulties. We're all right? We're good now? Okay. So let me go ahead and get started. So there was a few things that came in. The first question that, or one of the questions that came in was a question from Miss Sandra Abraham. And Sandra asks, every country controlling the curve tests, tests, tests. When can we expect to be in this position? Any idea of when the next set of test kits are due to arrive? What I can say is that we do have on-island testing. It has been something that has been a more difficult process than anyone would hope, but when you have a global shortage of testing equipment and persons that are scrambling to find tests, it's something that we are at least pleased that we're in a position to do some level of on-island testing. So I know that we have 150 test kits which have arrived in the country, and I know that we are going through that particular testing at this time. And so I know there are a number of tests that were done yesterday, a number of tests are done today. The turnaround is a maximum of 48 hours. The next set of testing kits are due to arrive, I would say, at some point in time within the, can I get that tissue, please? At some point in time within the next, I would say, the answer that the Minister of Health gave me was within the next 2 weeks. So that's what we're looking forward to our testing kits that are due to arrive on island. That will be 900. We'll have 950 total, and I've already asked for more to be ordered so that we have enough to test. But I'm sure that we'll be able to give the public an update on where we are regarding testing. As I said, the on-island testing has commenced. That means that we do not have to wait for as long as before. They will check the results with the Caribbean Public Health Agency, but we are looking forward to having additional testing capacity on island. But I do agree with you, the most important thing to do is to test, to isolate, to break the chains of transmission. And I think it's more important to think on a broader level, because that's one of the reasons why the government took the actions that it did. And it's important for us to recognize that without having the testing, some persons criticize us for being far too aggressive. But because we did not have the capacity for on-island testing, we have to be very aggressive at the front end in case there is any local transmission that is taking place on island. But I think it's important that we understand the totality of what this coronavirus represents. And there are predictions that there'll be many persons, most persons who get it, the symptoms are mild, but there is nothing that we can do in order to stop persons becoming infected with the coronavirus. Our job is to make sure that we have as limited community spread as possible to ensure that the persons who are most vulnerable, the persons who can get the most sick, have the ability to be treated in the hospital in an effective way and not overrunning our healthcare system, as we see in other healthcare systems in certain countries that have been overrun when they do not take aggressive measures to control the spread of the virus. So I thank you, Ms. Sandra Abraham, for that question. It is very important that we get the testing done, and we are ramping up that testing capability here on island, and we're looking to bring more options online so we can even do more testing. All right. The next question that I have is from Miss Sarah Westhead. And it says, why are students who are put into quarantine on Tuesday only getting calls today? Also in reporting systems, so I don't know the timing of calls. I do know that certain people who arrived later than Tuesday were actually called as recently as on Thursday, but I know that they are going through this calling process. What I have to say is that this process is being staffed up as quickly as possible. We know that there's a number of persons who have been making calls. Additionally, we are building out electronic capabilities so that the questions and the queries can be answered electronically. If, of course, you do have any symptoms, you're more than welcome to call the hotline, which is particularly important that you can call, and it's available from 9 a.m. To 9 p.m. every given day. All right. Here, the next question says, how will it be helping the single parents who are currently using savings to buy food, etc.? Will financial assistance be helping with the first month's rent or half deposit in any way during this time when we may have lost their jobs? The Minister of Labor, Community Affairs and Sports prepared something for the Cabinet last week Tuesday. There is going to be a Cabinet meeting that's going to be taking place tomorrow afternoon to finalize, and that plan will be announced and will be fully staffed on Monday to provide assistance to persons who have lost their jobs or are not working due to the measures which are being taken regarding the coronavirus. I don't want, and I don't enjoy the fact that there are so many sectors in the economy which are affected. We took the step to effectively close our tourism industry. We took the effect to close our tourism industry when we said that persons will be required for a mandatory 14-day self-quarantine when they arrive to the island. There were additional measures which were taken by the Minister of Health. Yesterday for additional public closures, which which are taking place. And I think the message that I gave to everyone in the press conference, which I held yesterday, was a very simple one and a very important one. Please, can you follow the self-quarantine regulations? The reasons why we are trying to allow activities to continue. The reason why we're trying to allow activities to continue is to make sure that we do not have severe economic dislocation. And so from that particular perspective, it is important that people follow the self-quarantine guidelines. But there are going to be measures that are going to be announced on Monday that will give support to persons. And the fact is that if everyone follows the rules, and if everyone follows the guidance, and if everybody follows the advice, we will certainly be in a position very shortly where we will not have these draconian measures, because as we're able to catch up to testing, then I think we'll be in a better state than we have now. There are a number of questions and comments from Ms. Shauna Benefides, Catherine Kemp, Nikki Maloney, and Elisa Claver, which made comments and asked questions regarding the Delta flights which are coming from Atlanta. It says, how can Bermudian students or any Bermudians still in the United States secure a seat home on any of the Delta flights that will be coming in over the next days to take Americans back? How do Bermudians in the U.S. book a place on the Delta flight to come home? So our airport has been closed to scheduled commercial traffic as of last night. We are aware of the U.S. Consul General had called and said that there were provisions for us to or provisions could be made in the exact same way that Canada had requested if there were U.S. citizens on the island who did not want to remain in Bermuda, who wanted to return back to the United States. I don't know why they would want to return back to the United States and not be here in our wonderful sunshine. However, that is the choice that they have made. What I have said is that certainly we're not going to deny the request of our largest trading partner for them to have the ability to repatriate any of their citizens if they wanted to be repatriated. What we did, however, say is that we do know that there are some Bermudians who are still stranded overseas. These are persons that were on cruise lines that were certainly stranded, and others around the world. The United States is putting on those flights for the next, I think, 3 days. And we have said that if there are Bermudians that are wishing to come home, that want to make sure that they're going to be a part of a mandatory 14-day self-quarantine or a quarantine in a facility which has been identified, then they will be allowed to return home. At issue in this particular case is that the Delta agents are being careful that they don't put anyone on the flight. I think the flight that came home today had 4 Bermudians that were stranded, so it's kind of interesting if you think a very big plane with only 4 persons on it. But that's where we are right now. And those individuals, so if you're looking to get on the flights, you can go to the Delta website, and I think the flights are for the next 3 days. After that, there are no regularly scheduled commercial services that are planning on coming. There was a question about persons who are still stranded in the UK, whether or not any provisions have been made. At this point in time, there are no additional provisions for there to be flights from the United Kingdom to come back to Bermuda. If that situation changes, we'll certainly notify, but at this present point in time, there are no plans for there to be any more flights from the United Kingdom and or Europe at this point in time. There's a question that says, has the customs officers that were working when the 2 infected persons returned to Bermuda been tested or assessed the virus? What measures were taken regarding their families? What I would say is that I do not know if those persons were particularly tested. I know that the chief medical officer did address some of these questions when they were asked by the media, but I think that we have to make sure that we are certain about how the spread of the coronavirus itself works. I know that customs officers did have gloves and did have masks and at the border, and I think that they've had the gloves and masks for some time. But I do not know specifically whether or not they have been assessed. I'm sure there may have been some type of conversation which has taken place, but I think that it's important for us to recognize that the virus only spreads when we're talking about the spreading of respiratory droplets. It's not necessarily spread in other ways. A question from Ricky Johnson says, can you clarify what quarantine should look like for household members of returning travelers? I know we have released guidance on this, but we have no way of knowing how people are practicing precautions within the home. Wouldn't it be best to require the whole household to be quarantined? The answer to that question is no. And I think that it's important that we recognize what quarantine actually means. Quarantine does not mean that someone is sick with the virus. It does not. That is, or anyhow. Quarantine and the definitions of quarantine is whether or not someone has come from a place where they may possibly have the chance to have been exposed to the virus, and therefore they do not want to be, therefore they want to be kept away from the possibility of transmitting that virus to someone else. It does not mean that persons who are on quarantine have the virus, and I think that's certainly something that is very important for persons to remember. Quarantine is where you keep people away just to make sure for a certain period of time in case they were exposed to the virus. Isolation is when someone has possibly been in quarantine and then they start exhibiting symptoms, and that is a higher level which takes place. So I want us to make sure that we have the difference here. I think that we also should remind everyone that there is a very important resource which is available online, coronavirus.gov.bm, which has all these wonderful pieces of guidance. This piece of guidance, of course, is a self-quarantine guidance, which I think that Ricky Johnson is speaking about. And it does state what persons are supposed to do inside of their particular homes and what they're supposed to do to make sure that they are keeping effective self-quarantine away from family members. Here's what is important, however. And when this self-quarantine came into place, there were some persons who were concerned that the government of Bermuda, that the government of Bermuda is looking to, that the government of Bermuda, they said they can't quarantine at home because they don't have the effective capabilities, that they don't have the effective capabilities to quarantine at home. So the question then was, would we make facilities available for them? We did speak to some of our hotel partners. who assisted us. So persons who are coming back who are unable to effectively quarantine at home are being given the ability to quarantine at a hotel facility for 14 days. So we took that on board, and we're certain that it's of assistance. I think about 20 returning Bermudian students have taken advantage of that particular situation. All right. Okay, there's a question that says, as a school counselor, I would like to ask if the deadline for Bermuda government scholarships will be extended due to the current crisis. I don't actually have an answer to that question, but I would imagine that that's certainly something that we could consider. We've extended a large number of other deadlines, and it's certainly something. I appreciate the question. Can't give you an answer now. What I can say is that if the deadline is happening during this, it is certainly a sensible precaution for that deadline to be extended, and we'll do the best to make sure that we can. The next question says, is there any way, from Andrew Marsh, and he says, is there any way that we can maximize social distancing by having a dial-in service to grocery stores? This will help protect the employees, the public, and flatten the curve. It is a good suggestion. I do know that there are a number of grocery stores that are offering delivery services currently online as it is. And so I think that persons, if they wish to take advantage of those particular precautions, not those particular cautions, but those particular services that are there. So that's just something that I would suggest and recommend without question. There was another question regarding, are there any 24/7 COVID-19 hotline available? We don't have a 24/7 COVID hotline available. It is it's a 12-hour hotline. It's open from 9 a.m. to 9 p.m. And persons, can someone please answer this phone? It's the third time. I think that someone calling for an approval of release. The hotline from 9 a.m. To 9 p.m. is 444-2498. That has been published before, but it is 444-2498, and that is the hotline which is open from 9 a.m. to 9 p.m. Alexander Abbott asks, what is the reasoning behind allowing businesses to continue to operate, seeing that this will encourage more people to remain in the streets and contact with one another? We can't be sure that the virus isn't already making its rounds with our people. Wouldn't this make matters worse by jumping the gun? And I appreciate the question, Alexander, and it is a very difficult balance that the government is trying to make sure that we maintain. So the government is actually being more strict than the World Health Organization guidelines actually recommend and suggest. And this is being taken due to the reduced testing capacity which we've had previously, which means that we cannot actually state what level of community spread does exist, if there's any level of community spread. The fact is that we have no evidence of community spread, but that is, I think, more due to our lack of testing capability than being able to actually have a significant testing capability and then to say that there is no community spread. What is important for us to recognize and to understand is that this is a virus that is going to make its way through the population at one point in time. And so individuals will say, why does the government of Bermuda shut down our borders and close everything for 3 weeks and then we'll be done? That's not exactly correct, because the virus itself will continue to exist and continue to circulate in life. And unless we want to shut down the entire country, until there's enough vaccine that's available, a vaccine that has been developed and is safe, and enough persons in the country get vaccine to prevent there from being persons who can transmit it here, then you're talking about 1.5 years. And it's just not practical to think that we can shut down the country for that long. So there is certainly a balancing act that is having to take place here. So we want to make sure that people are continuing to practice social distancing. We want to make sure that at this point in time, we are keeping persons with that distance, but we want some measure of the economy to continue to function in certain ways and in certain areas. So that is the reason why we have struck this particular balance. There were guidelines which were issued speaking about various types of operations which are open and which are closed. I know the Minister of Public Health had put out a public health notice of closing a number of facilities due to the chance of an outbreak of COVID-19. So for us, we just need to make sure that we are being very careful and very cautious in this regard. But what I said in my press conference yesterday, and I think this is particularly important for persons to remember, is that if everyone does their part, if everyone follows the social distancing guidelines, if everyone follows what must actually happen and take place in order to get through this period, then Bermuda's economy will be able to persist. We can look at certain countries, and the countries that Bermuda is going in its strategy by is countries like Singapore and Taiwan and Hong Kong, who have been very aggressive in tracking cases, who've been very aggressive with self-quarantine and making sure that they are controlling the community spread. They have far more testing at their disposal than we do, but we are ramping up our testing capability, and we're also ramping up the capability to track the persons who have contracted the virus here in Bermuda to make sure that we can stop the chain of transmission. And that's what's most important, stopping the chain of transmission. So I thank you, Alexander, for your question. It is a difficult balancing act, but we have to recognize that the entire country, it is impossible to shut down the entire country for a number of points in time, because even at that point in time, you then still have to worry about outbreaks. So we have to make sure we manage this in a good way. And the best way to do that is going to be to ramp up our on-island testing capability, make sure we test, make sure we check the chains of transmission, and make sure we break those chains of transmission. And as long as people maintain their self-quarantine, maintain their social distancing, and maintain their hygiene, we will be in a decent space. Is that what just came in phone call? Okay, so it's going to be tomorrow. Okay, got it. News is changing all the time. So I just found out, and it was just passed to me, that Delta Airlines is only available tomorrow for any Bermudians that are returning home. So it is only available tomorrow on March 22nd. And so that's something that is particularly important for anyone to note. As I said, there are 4 Bermudians on the flight, and it's basically coming down to take persons from the United States back to the United States should they want to go. And I guess that means that there was not the capacity that they were expecting, so there's probably only 1 additional flight. Okay, the next question is, as a small business owner, we were advised by our landlord that the premises will be closing on Thursday, March 19th, midday until further notice. Today, Saturday, March 20th, we were advised the building would reopen for business with normal access to the public. Can you please advise whether or not we should be at home, practicing social distancing, or we should be at work or encouraging customers to shop? This is a very, very, very important question, and it's something, there was a release that went out yesterday. And this is some of the good things in social media and the bad things in social media. So there was a document that went out which was spread widely on social media, which had stated a number of items from the Ministry of National Security. Unfortunately, that was a draft document that was not meant to be shared, and somehow it got shared widely. That document itself, there was a release that was put out yesterday where that document was retracted, or it was stated that that document is not the correct guidance, and the guidance of which was sent out is this particular guidance right here, which basically notes the social distancing and closure schedule for everybody to follow. I think it was upon that basis, and if you're a small business in the Washington Mall, I think it's upon that basis that that instruction changed. First, I want to apologize for any confusion of which that caused. We're trying to make sure that we get accurate and singular information out to the public, so that's certainly something that did create and cause confusion. And the last thing we want in a situation like this is for there to be confusion which is caused. So that is an error. We're certainly not perfect. However, what is important for retail establishments to understand, and many retail establishments have done this, is to practice social distancing and to practice hygiene. So for example, today I went out to get some things for my children. My son asked for Fruit Loops this morning, and going out to the grocery store, I made sure I washed my hands before I left. I made sure I avoided directly touching any doorknobs. I made sure before I entered my PIN into the keypad at the grocery store, I hand sanitized my hand. I entered my PIN inside of that, and then I hand sanitized. I put sanitizer in my hand after I entered my PIN. And I came home. And I think that as long as grocery stores, as long as other stores are enforcing and practicing good hygiene and good social distancing, then we will be okay. And that's what's most important. This is just like any other virus. And when you talk to the World Health Organization, or if you follow any of these other particular guidelines which are out there, they will say that the most effective way to break the chain of transmission is good hygiene. And fortunately for us, we've been stressing this for the last 4 weeks, reminding persons to wash your hands, not as difficult as it is, I'm sure all of you have seen because my face is somehow itching me right now. Touch your face, especially if you do not haven't washed your hands. Try to make sure you avoid touching other people, that level of contact, and in order to keep your distance. It's a difficult balance, but what we're trying to do is to make sure that some semblance of the economy can continue to function and we can effectively break the chains of transmission. If we cannot break the chains of transmission, then we're going to have a particular challenge. And so that's why it's important for every Bermuda resident to take this seriously so that we can continue to make it through this point in time until it gets to a place where we are in a better state. We don't want to get to a worse state. And if we talk about the fact that this is our economy we're talking about, this is our country we're talking about, we can all make a difference if we do what we have to do. If we don't, we're going to not only have serious health repercussions with our senior citizens and the vulnerable population, but we're also going to have even more severe economic consequences, and that's certainly not something of which we want. Question is, how can the government ensure that quarantine is being followed? Well, I know for persons that are in the hotels, security is monitoring that particular quarantine. I know for the persons who are self-quarantining, by and large, most people are following them. But what this is really about, unfortunately, unlike Hong Kong, we don't have tracking devices which have been put on everyone's hands to make sure they're enforced in their quarantine, or other states which may have a lot less freedoms than we are, where they're tracking people's phones. This is about the entire country. And if you knew someone who's come home from school and isn't enforced their quarantine, call the helpline and let us know. Because it is enforceable. It is enforceable by law. The helpline is 444-2498, and it's all of our part to make sure that we are being responsible. But I think that family members, by and large, recognize the severity of this, and persons who are in quarantine are doing what they have to do in order to follow self-quarantine guidelines. Those persons who don't have the ability to do that where they are the persons who don't have the ability to do that where they are being given alternate facilities in which to do that. So we cannot necessarily be sure of who is following the quarantine, but this is why it's important for all of us to understand that we all have our part to play. This 14-day self-quarantine is incredibly important, and if you know people who are breaking it, or if you're encouraging people to break it, think about the fact that you can be putting people's lives at risk. Nobody wants to bury their mother, their grandmother, their grandfather, and so if you know something, please call the hotline on 444-2498. The question came in from Beverly Miners. It says, I agree with the closure of social gatherings. However, my concern is churches have been asked to close their doors according to your public social distancing closure, while bars and clubs can still remain open with a maximum of 15 people. Why are churches not allowed to open when bars and clubs are? That is an excellent question. It's not the first time I've particularly heard that question, and it's a question that, as I said, a lot of persons have asked. We went by the guidelines from the Ministry of Health. One of the particular challenges are that when it comes to churches, it is one of the places where we see in other countries where there is the biggest risk of community transmission that does take place. But I'm happy to go ahead and give an undertaking to review those possible guidelines, have a discussion on Monday to see if there's guidelines that can be changed. But I think we have to recognize that these guidelines, though they have been issued, they are always subject to review. And when I say they're always subject to review, it's important that we recognize that with our on-island testing capability, if we are able to increase, I would say, the amount of tests that we have on island, if we're able to test as many suspect cases, persons with symptoms as possible to ascertain the level of community spread, then we'll be able to possibly relax some of those guidelines as long as people continue to practice good social distancing practices and good hygiene practices. So I thank you very much for your question. It is not the first time I've heard it, and we will look to undertake to revise those guidelines on Monday, should we need to do so. So thank you for the question of which you asked. And I want to thank everyone who's writing in. I'll do my best to get through as many questions as possible. This is actually going quite quickly. And oh my goodness, so looking at my screen, I see 981 people. Apparently we have 1,000. This is kind of scary. I feel like I'm under a lot of pressure. Forgive me, my children are going to come in to say goodnight soon, so don't be alarmed. I might ask them to say hello to everyone. They will get very excited, but they were enjoying the time outside earlier today. Daddy tried to take the day off today, but the event certainly caught up with me, so I wasn't able to have much time off and spend a little bit of time with my family. But I'm sure that's the same for all of us who are on the front line, the healthcare workers, persons in essential services. So I just want to make sure we give a shout out to them. There are people in the Ministry of Health who for the last 4 to 5 weeks have been working flat out. And they, I think, deserve all of our particular gratitude. We move to the next question. It says, while I understand, this is from Sandra Abraham, while I understand that the livelihood of all Bermudians are at risk. Oh, good night, my princess. How are you? You gonna say hi to everyone?
Good night, Daddy.
Oh, yes. You say hi. You have to look into the screen. Say night, night. Look in the screen and say night, night, everyone.
Night, night, everyone. Night, night, everyone.
All right. Have a nice night.
Daddy, that's another light.
Yes, it is another light.
But that's what.
Yes.
And the thing on the bottom is a tripod.
It's a tripod? What do you know about all that? Touch?
Dana told us to talk about it.
Dana told you about that? All right.
Yeah.
Then he has to go back to talking to everyone, okay? See you later. Make sure you go to bed, all right?
Yes. Well, first we're going to watch Pinocchio.
Oh, you're going to watch Pinocchio? Oh, boy.
And no.
Yes. All right. Bye-bye, Ed.
And on Dana, we got a shower in our mommy and daddy shower. And guess what my daddy puts on my feet?
Ed, you got to go upstairs.
Hot sauce. And fire.
Oh, boy. They bring me incredible joy. The next question says, back to the question from Ms. Sandra Abraham. It says, while I understand that the livelihood of all Bermudians are at risk during this tremendously stressful time, but is having the restaurants and bars a good idea at this point until we know what our numbers with incoming residents are? Well, here's the first thing. Incoming residents are under self-quarantine. So that minimizes the transmission risk. So that's the first instance. I did also say that we're trying to strike a very delicate balance between the total shutdown of the economy while making sure that we put sensible restrictions in place that will allow there to be some level of economic activity to continue while persons are able to practice social distancing that they have to. So this is certainly something that we will continue to balance. And I think that we'll have a clearer picture this week as we ramp up our on-island testing capability of where we are as a country. But I cannot stress enough the importance of persons keeping their self-quarantine It should be particularly interesting. I'm sure that persons are going to start posting pictures of themselves in quarantine with their, beards and their hair growing out and other types of things. But it is very, very, very important that you maintain this particular quarantine. A question came from Lisa Trott. Forgive me, guys. I don't think I put lotion on after I wash my face, and my face is just a little bit itchy. So that's why I keep touching my face. I'm sure a few of you are wondering why the Premier is not following the guidelines, but I did wash my hands right before I came here, so I should be okay. It says, my question is this is from Lisa Trott, and her question is, why is the government not being more prescriptive regarding advising private business? Many are telling their staff that in order to work from home, they need a doctor's certificate. So let me be very clear. If there is any business that is telling persons that in order to work from home, they need a doctor's certificate, let me know. Feel free to send an email to premier@gov.bm, and that business will be very clear. On businesses, we have been said that the request is for persons to work from home and only minimal operations for corporate businesses. This is what is here. And so that is that working from home is to be a first option during this particular point in time. That is what we have with government offices, and that is certainly something that should be the case. So if that is something that private businesses are doing, private businesses, stop. If your employees have the capability to work from home, let them. This is important at this point in time, and we all have a part to play. I am certain that no private business wants the country to go into a total shutdown, but that's what will happen if during this phase, when we are analyzing what the level of spread may be in our community in order to make sure that we keep as much people home. What I do have to say is that I think that by and large, Bermudians are being very good with obeying the quarantine and making sure we keep our social distancing. But it is important and will likely be with us for an extended period of time. But just to you, it is very, very important that persons and private businesses, and if there's a private business that is giving this advice, that is saying that you cannot work from home, feel free to email me at premier@gov.bm, and we will make sure that that private business is spoken to. Sarah Ann Topley says, too many are still going out and carrying on as usual. Can we look to holding a 2-week shutdown island-wide and enforcing this? I think I've kind of answered that question before. I don't actually think that people are going out and carrying on as usual. I think that by and large, Bermudians have heeded the requests and advice for social distancing. But sadly, if people do not, and then we will have to be a lot more serious in how we're dealing with this. And so I'm not going to take any option off the table. Certainly we're going to act in the interest of public health, and the interest of public health is one that is particularly important. So from that, what I would say is certainly, persons, to my belief and understanding, most persons are following these particular guidelines. And if you care about your community, if you care about people's families, then you will continue to do that. Happy to see that restaurants are obeying them. Happy to see that persons are obeying. We have had the police, which did checks at liquor license establishments today. They will be doing the same tonight. They did them yesterday. They'll be doing the same tonight. I know there were checks that were at various public health persons, such as salons and spas, that were ordered to close while we are in this initial phase of making sure we can see whatever level of community transition there may or may not be. But I hope we don't get to that point. And the only way we're not going to get to that point is if everyone cooperates with the social distancing, with the hand washing, with making sure that we are not persons who are spreading this disease locally. Same question is related from Ms. Tammy Ingham, who says, would you consider a curfew or possibly a lockdown for perhaps a week to slow the spread? People are not taking this as seriously as they should, and we could end up in a very devastating position. My information is, and this is what I get from the persons who are out, that we are taking it seriously, that most stores are taking it seriously. However, it is certainly something that we will consider, and if we do find that there is any level of community transmission which we think we are unable to break, we will certainly do that, and we will not hesitate in order to take that action. As I said publicly, I do not have no intention of burying my mother this year, and I have no intention of allowing the health system in this country to collapse or be overwhelmed. So we will act strongly and decisively, as we have already, based upon the information which may come to us at a certain point in time. A related question as well says, I live in a condominium development where the children who live here, about a dozen children, are far from socially distant. I think that for the next 2 weeks at least, that you're asking parents to keep their children inside their homes. Will you clarify this point, Mr. Premier? What I think is important, that children are obeying social distancing. I do not believe that the circumstance in which you stated is particularly wise, but if persons are washing their hands, if persons are not sick, if persons are doing what they should be doing, then that level of interaction is not terribly bad. What I think is important is that persons are seeing what is taking place overseas. And Bermuda has been very strong and very aggressive on this for at least the last 4 to 5 weeks, when this was first declared a public health emergency of international concern. And I think that we're in a better place than others are, because we've been repeating the message of social distancing, repeating the message of washing your hands, repeating the message of not touching, and if you are sick, making sure that you stay home. So I think that there's certainly a balance here, and what we will note though, however, in our social distancing guidelines is outdoor activity is okay if you're under social distancing. If you are under quarantine, however, no, that is not what you are supposed to be doing. You are not supposed to be going outside. You are supposed to be inside and making sure you remain at that level, which is very important. Another question came in, are you prepared to impose a curfew and mandated social distancing? If the circumstances require, the government will not hesitate to take the actions which are necessary. I think that the actions of which we've taken to this point are certainly proportionate. There is without question increased risk to the community due to the persons who return from the United Kingdom. That is the reason why we enforce and have an enforceable home quarantine, which is put into place. The penalties are $6,000 for the first offense for breaking it, and $10,000 or 3 months, up to 3 months imprisonment for the second offense. Don't break it. Just stay inside during your points in time. If everyone does that, we will be okay. There's a question that came in that says, can we set up an alternative place to go for treatment other than the hospital? If we had a place to go like a school and then transfer equipment from the Lamfogo facility and other private doctors' offices, can we have another treatment center helping to ease the load off the hospital? I'm certain we can if we get to that place. The Bermuda Hospitals Board has been preparing for this for some time, and I believe that we're in relatively good stead. We do have the ability and capability to have remote hospitals, field hospitals. We do have other medical facilities, as stated, the Lamfogo Urgent Care Center, and others should the need arise. But that need will not arise if we all practice the necessary social distancing and keep our proper hygiene. That means washing your hands and all the other things of which we have stated. That is what is most important, and that will prevent the need or the possibility of our healthcare system being overwhelmed. I see a question that I read online that says, is Bermuda in need of more tests? The answer to the question is yes, we are in need of more tests, but I think it's important that we discuss testing because testing is something that in any time there's a crisis, there'll be a whole lot of people that are trying to take advantage of a certain circumstance or a certain situation. So the most accurate test which is being used to diagnose is actually a DNA test. And it's a real-time DNA test which can happen. And that is something that we have. On island right now, we have 150, we have additional testing capability, which can increase that number a little more, and we have more testing kits which are arriving on island over the next 2 weeks. So we certainly do need more tests, but we have to recognize there's a global shortage. What is important, however, is this is a type of test which is run on specialized machinery that can actually read and compare a DNA. But what other tests which people may have seen online or on various websites is this test where you prick your finger and drop it in the blood or drop the blood inside and put a little thing on it, and it's kind of similar to almost a pregnancy test, people would say, and it can give results within 10 to 15 minutes. Those are not the type of tests of which you would use to diagnose if someone has COVID, because those tests are antibody tests, and so that means that those tests come up positive after someone has caught the virus, their body has fought the virus off, and now they have antibodies in their virus. So it's detecting the presence of antibodies. So we cannot use that to diagnose community interaction. We will be getting some of those tests because it's important for research to understand how the transmission may have happened inside the community. So when we have a level of those tests which are verified and certified, we'll certainly be getting more of those tests on island. But those tests are not the ones that can test whether or not people have, persons who have symptoms, persons who may have starting to develop the symptoms, fever, etc., and we test those persons. Those tests will come up positive if they have COVID on our DNA testing, but they won't come positive on that. And it's very important that people are not ordering these tests and testing themselves, especially people on quarantine. Stay in your home for your 14 days. Stay separate from your family for your 14 days. Do not be lulled into any false sense of security by someone who may be saying, oh, I have this test and you might be able to use it. No, stay in your home. That is the best treatment. Stay inside and stay quarantined. Okay, so there's a question from Linda Wilson that says, I feel that Bermuda needs to emulate what China did and shut down all over in order to protect the people. I accept what you're saying, Linda. I'm not going to say that that thought has not crossed my mind. But what is important is we have to operate based upon science. China let the infection get away from them. We will not let this infection get away from us. Understand and recognize. There has not been anyone in this country who has yet been hospitalized with COVID. And so I think we need to take it into account of where we are inside of this particular cycle. We've been very good at preventing wide-scale transmission, and I think that we need to be very consistent with that. However, as I say, shutting down for 2 weeks now doesn't mean that we will never get the virus. It's not something like that. We have to remember that we have to properly manage it. So we're looking at, and this is important, we're looking what happens after these 2 week period. No one wants to extend school closures, no one wants to extend government closures, no one wants to extend public transport closures, etc. So we have to look at how we live in this new normal. But the best way to understand that is to ramp up our testing capability and for everyone to keep remembering, as long as they follow the guidelines that have been laid out, we will be in a good place. One thing I will say, however, is that I am sure and certain that there are persons who flew in from the United Kingdom that did have the virus. The only people of whom are landing on this country are Bermudians. But what they have to do is to stay inside. Anyone who has symptoms, they will be tested. Persons who land on the island that had symptoms were not quarantined. They were sent into isolation. And so there's a difference. If you have symptoms, you are put into isolation, which is far different than quarantine. Quarantine just means there is a chance that you may have been exposed, and you need to keep away just to make sure during that 14-day period to make sure that you don't have any symptoms which may arise. There's a question, sorry. There's a question from Curtis Smith. And he says, has there been any consideration given to having a cruise ship from any of the cruise liners to set up as a hospital should KMH become overwhelmed with coronavirus cases? The question is yes, actually. There has been certain consideration that has been given to that. Under the abundance of caution, it was decided that that probably wasn't the best idea. I think you would have seen a press release about that NCL had requested for some of their boats to dock here while they are currently stranded, and the government, after considering the requests and the conversation back and forth, we decided that that would not be the best course of action. But I'm hoping, Curtis, that we never get to the point where we need that. And I sound like a broken record, but the only way we're going to avoid that is if everybody does what they need to do. Wash their hands, maintain appropriate social distancing. If you even start to feel a little bit of tickle in your throat and a little bit of cough, stay home. Stay home. Some of the symptoms of this virus are incredibly mild, very mild. Someone described it as it just felt that they were a little bit hungover and they had a little bit of tickle in their throats, and then the next day they felt fine. Depends on how your immune system is. Stay home. If you feel sick, stay home. Take the day, take the 2 days, stay home. The Employment Act gives sick leave to every employed person in the country. Please stay home if you are sick. That is critically important. A question from Stephen McGinnis says, there's a significant economic strain and difficulties that are a result of this, not just Bermuda, but the world. What are some of the short-term and longer-term initiatives that the government is looking at, and how are we hoping that the private sector is able to support this going forward? It's a great question. I don't have full answers for that right now. What I can say is that we've actually organized the cabinet into various sections, and there's a section of the cabinet who's working with not only the cabinet persons, but persons inside of our caucus and involving others, such as the Bermuda Economic Development Corporation, the Bermuda Business Development Agency, the Bermuda Tourism Authority, and others, thinking about what are the next steps. How do we get Bermuda back on track? What is it that we need to do after this particular virus and this particular emergency time passes? So given those type of considerations that we have, we're going to be looking to see what is necessary in order to do in those particular not in those circumstances, but going forward. So certainly private sector will be a part of that. I'm happy for the private sector to be a part of that, and I'm sure that everyone recognizes the need to make sure that Bermuda's economy is able to return to normal and able to thrive. And so, as I said, that's a difficult balancing act of which we're currently in right now, but it is my hope that Bermudians are obeying self-quarantine, that people are doing what is necessary. People are doing what is necessary to keep the country safe. And as long as we keep doing that, I think that we'll certainly be in a good position. But thank you for your question, and that work is ongoing, and that work has started and is being led by the Minister of Finance for the general economy portion, and it's being led by the Minister of Tourism and Transport for the tourism and hospitality sector. There's a question that came from Erica Morandi. It says, I'm a spouse of Bermudian, and as I work as a nanny, am I obligated to go to work? I would say that that would be a job that might be difficult to work from home. I would say, however, that if you have felt sick, that you certainly should not go to work. And if you are under a self-quarantine order, then clearly you are not allowed to go and work. But I don't believe that there's any type of restriction on that. That is not a particular job where you can work from home, and we're not in the place where persons who are unable to work from home are being told that they cannot work. Hopefully we do not get there, and it is my job to prevent us from getting there, which is the reason why we've taken the actions that we have taken thus far. All right, so apparently there's a whole lot of questions which are being typed, and I'm going to try to get to them. I think I'm at 8:32. So I think I've got 28 minutes. I'm known for giving very long answers to questions, so I'm really sorry if I'm giving them long questions, but I'm trying my best to go through as much as possible. I hope that you all are enjoying this, and I hope that you are finding the information useful. I was trying to do something informal. I know there's a few of our football players at home and a few of them here. I'm wearing my Bermuda football shirt because most people know that I am a huge football fan. And I think that's part of the toughest part of this quarantine, that I can't watch my beloved West Ham because football games have been suspended and sport games have been suspended. But that's where we are. Okay. Next question. What happens if I see people congregating in groups and not following social distancing? Can I report them? Is there any penalty for violating them? There are no particular penalties for violating, there are penalties for violating any of the orders which have been issued under the Quarantine Act and or the Public Health Act, so those are punishable by law. Regarding congregating in groups, if they're outside, if they're not touching each other, if they're maintaining appropriate social distancing, that's not particularly a problem. If they are inside of a bar or a restaurant and there's more than 15 people inside of there, you are welcome to report them to the police, and that place will be shut down and their liquor license will be temporarily suspended. We are not playing. And so feel free to go ahead and report them in that particular instance, as those things do have the force of law, and it is the responsibility of those persons who are there to enforce the law to do so. But the other option is have a chat with them and just remind them to understand what they're doing. But as I said, outdoor congregating, maintaining appropriate social distancing. I know that a lot of persons who are personal trainers and can no longer personal train at the gym are moving themselves to outdoors, not on outdoor gyms because you will still be touching things, but working on the grass, things that people did before we had gyms. And so those are acceptable inside of our social distancing guidelines. And that level of physical activity is certainly something that is allowed. But if you are under quarantine, no, do not go out of your house. It is not allowed. You must stay inside for those 14 days. If you need help and assistance, have someone bring you food, have someone take care of your stuff. I know it is hard, I know it is difficult, but think about the community. That's what's important. Next question says, a lot of people who are supposed to self-quarantine because they come into contact with someone or who are recently overseas. What about these people, the ones that are required to self-quarantine? How is this enforced? I'm not entirely certain of whom has been required to self-quarantine in this particular circumstance of which is being raised. What I can say is you're not required to self-quarantine if you've been in contact with someone who's been overseas. You're required to self-quarantine if you have come from overseas. And if you are self-quarantined properly and correctly, you are not in contact with anyone else. And that is what's important, to follow the self-quarantine guidelines to the letter. That is what is important. This question that says, when the government discontinued public transportation for buses and ferries, there was no instruction given to taxi operator, minibus operators, limousine operator, or ATs. Can you please advise whether or not our service are required and or should be expected? I believe that there was some guidance that was issued. I have to check. I would ask that you check coronavirus.gov.bm. If it is not up on that website, I thank you for your question, and we'll make a note of it, and we'll make sure that we get some guidance that is issued to those persons next week. I'm sorry if that did not happen. I know it was a gap. I know it wasn't issued at that time, but certainly we will be issuing updated guidance so you can be aware. The most important thing is to maintain social distancing and to maintain social distancing and to make sure that you are not touching or in contact with persons. And if persons are sick, I would strongly recommend that persons who are sick, there are no visitors, so we'll start on that aspect, but persons who are sick should be at home anyway, so they should not be inside of your taxi. There's a question that says, if people can't self-quarantine in their homes, what assistance or other options are there for people? Persons who come into the country, who are returning residents who are unable to self-quarantine, were given the option of staying in a hotel, and that option was available for persons. There was a question says, how do we find out about quarantine-related closings? I'm not sure that the government is maintaining an updated list, but I would strongly suggest that we look on the government website on this wonderful thing, which is coronavirus.gov.bm, which is regularly reported. This was also sent out in a press release today, so it'll be on all media formats. And this is the social distancing and closure schedule. So I'd strongly recommend that you take a look at this, and it gives the expectations of various items which are open and closed. Next question is, what are we doing about transportation? Bermudians stranded in their homes and unable to get supplies they need. What are we doing for them? If there's any Bermudian who's stranded, unable to get supplies which they need, the first thing I would say is to call the coronavirus helpline. That helpline will be, the hotline is 444-2498. What we are doing, however, is there are a number of helping agencies which are helping to make sure that persons who may be stranded are getting the help and assistance of which they need. I know that there's that we are trying to make sure that we coordinate that as well. If the situation moves to a shutdown situation, we do have public officers who are ready to make sure that things are delivered to persons where they need to go. It's an important thing to note, and I've said it a few times, the government of Bermuda is not closed. We are just working from home. So there are many government departments and public officers who may be redeployed to other aspects and other activities should the need arise. I'm grateful to know that that has the support of the unions and our union partners. And so, as I said, this is a very fluid situation. The actions which were taken over the last week was to allow some space for us to get our testing up and running here on island so we can be fully aware of what is any type of level of community spread in Bermuda so that we can keep a handle on this virus. So that is particularly important. It says, do tradesmen that work outside still allowed to work? The answer is yes, as long as they are maintaining the appropriate social distancing guidelines. Working outside is a lot less than working inside, but I certainly wouldn't be sharing tools, and I certainly wouldn't be sharing water bottles and anything else. And if there are reports of persons who are not following either social distancing guidelines or doing what is necessary and required, that is a matter that can be taken up with health, and unfortunately, those sites will have to cease work. But what we're trying to do is to allow there to be some level of economic activity allowed to continue inside of the country, while at the same time we are controlling any community spread which may exist. Would it be wise for all returning residents to be in mandatory quarantine under supervision by our authorities? Yes, it would be wise. Whether or not it was feasible is no. What we are doing, and this, we believe that it is effective with the mandatory home quarantine, and we're providing facilities for persons who are unable to keep their home quarantine or unable to do that. Persons who become sick will be isolated, and those type of persons, and so if someone does quarantine in your house and they do become sick, that does then mean that that entire house will be placed under quarantine. The option is there for persons who do not have sufficient home quarantine facilities to quarantine at a hotel. That if persons require that, they're welcome to call the hotline at 444-2498. Any word on the collection of trash? I don't have any word yet. I'm sure there'll be an update that's going to take place tomorrow after tomorrow's EMO meeting. We want trash collection to continue, and we're expecting trash collection to continue, and we will do everything in our power to ensure that trash collection does continue. Trash collection in Bermuda is an essential service for public health, and we're going to expect that that service will continue throughout the next 2 weeks. What is going to happen to work permits in the process of renewal? What I would say is, like many other government issues, those matters will be suspended. I believe that there was looking at guidance to be issued on those particular matters. If not, we'll make sure that guidance gets out this week. I know it was something that was discussed, but we're making sure we get the information out on public health as a priority, and then we're dealing with answering those other questions such as, TCD licenses, etc. What is important, a related question about TCD, given that TCD is closed, persons are still required to have insurance for their vehicles. If you do not have insurance for your vehicle, you can still be ticketed for driving while uninsured. However, you can license your vehicle online you can find the links at www.gov.bn once your vehicle is insured. If you do not license your vehicle and your vehicle is insured, you will not get a ticket for driving without a registration. However, I would strongly urge you to relicense your vehicle online, as we can recognize and understand that when government offices reopen, there might be a very large crush at TCD, and it won't be an open-ended item. So we'll probably only have a week's grace period. So do it now, take care of it online, and you don't have any problems. That online service has been working for about the last 13 years, and you're more than welcome to go ahead and use it. It says, if we continue to allow persons to shop in person at essential stores, will be stronger measures put in place to ensure people stand far enough outside the store and checkout lines. I know there's restrictions that have been put into place. Many stores are following those. If you have a place or a specific place, whoever asks this question where you do believe that is not happening, please feel free to shoot me a message, premier@gov.bn, and we'll make sure to send out an enforcement officer to make sure those particular things are being enforced. There's a question about are passport renewals on hold until April 6th? Probably not going to be able to go anywhere, so it probably isn't the most important thing. But what I would say is that there are still essential services which are functioning. I do believe that the drop box at immigration is open. I don't have that list of immigration in front of me. But I do believe that they are open, not open, you certainly can't go inside the building and sit at the desk, so I'm not saying they're open like that. But if there are emergency situations, I know there's a skeleton staff who may be able to assist in that particular measure. Has there been discussion about repurposing vehicles which are no longer in use due to closures for essential deliveries, grocery, medical? Yes, there have been, and I did indicate earlier that the government itself is not closed. We are working from home and working remotely. And so in situations where that is necessary, then they will be used if we move to a different level of situation. So to answer your question, the answer to the question is yes. Will the authorities be actively pursuing people not self-quarantining and shutting down large gatherings? Yes and yes, no question about it. And if someone's throwing a party next door, feel free to call the police, because that's not following social distancing guidelines. The police will come and we'll shut it down. We have to be serious about what it is that we're doing. And I want to just say shout out to all of the virtual DJs who have been providing services to persons online over Instagram so people can party at home while maintaining appropriate social distancing. I know DJ Chubb did something earlier this week. iBreeze did something last night. Fresh Kid did something earlier today. And I think that Mr. Genius is doing something right when I sign off today. Thank you for doing your part to keep everyone excited, to keep everyone, give a little bit of reprieve from this I would say, difficult self-quarantine situation. But remember, if everyone does what they're supposed to do, this country will be okay, and we'll be able to escape the worst of it. Whereas there are other places where are in significant challenge because they did not do what was necessary at the very beginning. Do you think that April 6th is a realistic date for things returning to normal? I do not believe that things will return to normal by April 6th. But I do believe that we will have a better handle on where we are due to the increased local testing, and we'll be able to make appropriate measures so we can understand exactly what is happening inside of our particular community. So I don't think that things are going to return to normal April 6th, no. But there may be things that might return to normal or be relaxed or changed until that point in time. And I think that's important for us to recognize. Is there concern that our hospital will be overrun? Are there backup facilities in place? If some of our medical professionals contract the virus in time, could doctors from other jurisdictions that are recovering come help us to assist? Surely, yes. If we do get to a bad situation, we'll certainly welcome help and assistance. I do not have a concern that our hospital will be overrun, and I have no intention of letting us get to that particular point at all. And so, what I would say is if we have verified community transmission that we cannot crack down on, we will have to take more drastic action. And so it's important for us not to get to that place. question that says, how many workable ventilators do we have per Burt? Number off the top of my head, I know it's increasing. I think that it's 25. I think there's different things which they're doing. One thing that I have to be, what I must share with the public is that between the chief of staff of the hospital, between the infectious disease specialist of the hospital, I think he's the second in charge of the hospital, the chief operating officer of the hospital, the chief nursing officer of the hospital, and the preparations they've made, I think the hospital is very prepared for what may happen. But we're not going to get to the point where the hospital is going to be overrun. They ordered more ventilators. I know that more ventilators are scheduled. They even ordered more because they're fearful that we may get to that situation, but I can assure persons that the hospital is prepared. The question before is, are there backup facilities? We do have the ability to set up field hospitals should they become necessary. Yes, we do have that capability. It's something that was not just acquired for this crisis, but it's something in which we've had before and we've previously invested in. But I do not believe that we'll get to that point, and if everyone does their part, we certainly will not get to that point. There's a question about what about self-employed persons that no longer work? That's a good question. The Minister of Labor, Community Affairs and Sports will be unveiling what our economic assistance program looks like on Monday. And so I would encourage you to stay tuned for that. If your work closure or stoppage of work is related to the coronavirus, there will be assistance that will be made available for you. Next question. When under quarantine, can you go for a walk? No. When you're under quarantine, you're under quarantine. Stay at home. Don't go outside. That is what is particularly important. Stay at home. There's a question of what is the Delta flight number from Atlanta tomorrow. I'm very sorry, I do not know. I've been advised that you can go on delta.com to go ahead and book the ticket, but I think it's only the flight that's traveling tomorrow. Is there anything in place for hotel workers who are off now? Those details will be announced Monday. One of the main things why we didn't put this through financial assistance is because we know that process will be long. Sometimes we are doing this in a very quick fashion. I can assure persons that the Department of Workforce Development has staffed up. They've brought in temporary staff. They've reassigned staff from other departments. They'll be ready to receive queries very quickly, and our aim is to get relief to persons as quickly as possible. So you will be getting relief next week if you have been affected in the hospitality industry. When I gave my address last week, I said that you are not forgotten. The one thing I have to thank is the hoteliers who have come to the wicket in making sure they're going to continue, in some instances, providing some payments to their staff, and most importantly, making sure they continue the health insurance for their staff during this period in time. That is certainly something that should be applauded, and I'd like to thank all employers who are doing that and making sure that we are taking care of that critical need at this point in time. If we all do what we need to do, our economic disruption will be minimal. And that is something that is particularly important for all of us to remember. I don't know if I answered this question about whether when you're on quarantine, can you go for a walk? The answer is no. No, no, no. And there's these wonderful quarantine guidelines which say what you were supposed to do. Do not do that at all. Do not leave your house. No. All right, let's see. I'm not sure if this has been discussed already. Have you shared what expected timelines in which this will go on for? How will you know when the time is right to go back to normal? And the next question says, what happens after April 6th? We will continue to reassess where we are. We're about 15 or 16 days from April 6th. And so we will be able to reassess at that point. We'll be able to reassess before then. But we won't be back to our normal living for some time. We're going to have to adjust, and we're going to have to figure out how our tourism industry is going to survive and what are the types of things we're going to do. There's some persons, to get our tourism industry back up and running, say that we should, resume tourism, have persons quarantined for a number of days. If they're tested, then they're fine and they can go and continue with life here. We're going to be examining all the options on how to make this work. but it is a new normal. There's a question which says, what should landscapers be doing? Landscapers who are working outside should be practicing appropriate social distancing. Don't share tools. Don't. It's just it's that type of thing which is necessary and proper to recognize and to understand. All right. I see a comment that says, if you are on self-quarantine and need to buy food and use a delivery service, is the delivery charge for delivery waived? I don't think the delivery charge is waived, but I think that's a question that we can certainly ask those delivery services to offer. I think that we are going to have more delivery services that are be up and running to assist people that are on quarantine. I want to say thanks to all the persons who sent encouragement to myself, to my family, and to our cabinet, and to our government over this time. It's a very, very difficult situation. I'm extraordinarily tired. We're all trying to certainly deal with it as best as we can, but I will say that the encouragement certainly helps, and it's really, really good when people send messages, or it makes me feel good when people send messages of encouragement. So I just want to thank you all for keeping our spirits high, and I want to say that this work isn't easy, but I am gratified that I have the opportunity and a chance to do this work. Oh, there was a question about the Delta flight number for tomorrow. I now have it. It is Delta flight number 656, departing Atlanta at 10:59 a.m. and returning at 2:45 p.m. And I do believe that is the last flight in. It might be difficult to get to Atlanta at this point in time. They do have some early connections on Delta, but that is most likely the last flight that's going to be coming into Bermuda for the next 2 weeks. Trying to find a few more questions as our time is running short. It's hard to keep up. There's a question. Yep, we spoke about the quarantine guidelines, so I think people are answering those questions themselves. It says, why has the government not put in a grant program for small businesses in place to assist with their rent and to cover fixed expenses like utility and cell phone service as is the intricate part of their services? The first thing that I would say is that, number one, that we do know that utilities, no utility service will be disconnecting anyone due to late payment at all. So that's the first instance. The second thing regarding rent, this is something of which the government is looking at, and the Minister of Finance is working to see what exactly can be done at this period in time, recognizing that there's relief from banks on mortgages and other things. There should also be that similar relief that's extended to rent, etc. So that is certainly something which we're looking at. There may be a need for additional support to small business, and that might be something which may come. But our most important thing to do is to try to minimize the impact that this particular disease will have on our economy. And that's why it's important for everyone to make sure they maintain appropriate social distancing. I see a follow-up question regarding landscapers and the fact that they drive in the same cabin and cannot maintain social distancing. That is a no-no. So if it's in a cab, we need to figure out different ways and alternate ways of travel. I thank you for raising that particular issue, and that's something that will certainly log and issue updated guidance for those particular persons. So we're just about winding up. I'm not sure if there's any, someone asked, when is the next British Airways flight? I sincerely doubt that there'll be any scheduled flight from Europe for some time. Europe has a real issue with the coronavirus. There is certainly an issue, a growing issue in the United Kingdom. Without question, we see what's taking place inside of Europe, and there's no scheduled flights this time. There may be an opportunity for there to be some further repatriation of Bermudians, but we need to discuss what that actually looks like. I was on the phone with the Premier of the Cayman Islands a few days ago, and we were talking about possibly doing something in conjunction, as he also has an issue with some of his people who are in the United Kingdom who are looking to get home, but it's something that we have to be very careful with because it does introduce additional risk. And what is likely is if we do have additional flights, those persons may not be given the opportunity to quarantine at home. Given the advancing nature of this virus, they will most likely be required to quarantine inside of a facility. I think we are just about ready to end. I don't know if there's any other questions. There's a question that says, will medical insurance companies hold coverage for financially challenged clients? We have had good discussion with the insurance companies, and the answer in this particular instance is yes. And we're going to make sure during this period of time, everyone has to pull together. The last thing we want is someone losing health insurance at a point in time where there's actually a public health crisis. But we're certainly doing that work. There's a question that came in from Ms. Smith. I appreciate you can't answer now. This we discussed your meetings. Too many grocery stores are doubling the prices. If you have any evidence of price gouging, you are welcome to email premier@gov.bm. I spoke to and there's going to be an official form that's going up next week for reporting of price gouging as well. This is something that was discussed with the Minister of Home Affairs, who is responsible for consumer affairs. Also, the Deputy Speaker, Derek Burgess, is the chairman of the Cost of Living Commission. The Cost of Living Commission actually has the power to investigate and charge persons who may be price gouging. So if you do have evidence of price gouging, feel free to email premier@gov.pm, submit receipts, submit different things, all the rest. That is something that can be investigated, can be followed up, and will be prosecuted. Have no doubt about that. And it is absolutely unconscionable for any business in Bermuda to be trying to take advantage of a public health crisis in order to do that. That much being said, I went to the grocery store today, as I spoke earlier. There is no need to panic buy. There was plenty of toilet paper in the grocery store today. So persons who are panic buying, there is no need to panic buy. Please, 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 please. Our supply lines are secure. We are not expecting there to be any disruption, and there is no need to put yourself out financially engaging in panic buying at this point in time. Please understand that that is not necessary, and it is, of course, selfish. So I think that we are running towards the end. So what I will say is a reminder for all persons dealing with the hotline. The hotline is 444-2498. It is staffed from 9 a.m. To 9 p.m. Always remember that the website for updates is coronavirus.gov.bm. You should go to that website. It's updated on a daily basis, and it has all the information of which you need to know, including wonderful guidance and instructions on how to keep yourself healthy. So that's important. I want to ask people to please, 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 please do not spread misinformation. If there is real information, it will be at www.gov.bm/coronavirus or coronavirus.gov.bm. Very, very simple. Pay attention to official sources. The final thing of which we're going to say is that the Emergency Measures Organization will be meeting again tomorrow afternoon, and there'll be a further update from the government regarding the on-island testing which is taking place, any additional testing results of which you may have to share, and any additional measures which may have to be taken as a result of any test results of which we get back from the local public. So I want persons to make sure they stay tuned to that. I do not believe that is going to take place at 4 p.m. tomorrow. It most likely may take place later at about 6 p.m. as the cabinet is also meeting tomorrow at 3 o'clock tomorrow. So Yeah, I have a full day tomorrow. We're supposed to have a day off today, but we have meetings starting from 10 a.m. until late. So we'll make sure to try our best to keep you informed. So before I go, I want to again thank everyone for their attention. I want to thank everyone who is following the rules and the guidelines to make sure they continue to follow the rules and the guidelines. I want to remind people who aren't following those rules and guidelines that there are penalties and people are watching you. So if they report you, look forward to a $6,000 fine. I don't want to start fining people, but we will, because this is serious business of which we are dealing with when it comes to this particular public health threat. But as I close, I want to give thanks certainly to our frontline workers, those healthcare workers, the ones that are working in the hospital, the ones that are getting ready, the ones that are ordering the supplies, the ones that are manning the phones, the ones that are checking up on those persons on quarantine, the port health nurses, everyone who is doing their part to make sure that Bermuda comes through this particular crisis. It is an honor to lead this country. I think that we have responded very well, and we will continue to respond very well as long as we have a spirit of unity, a spirit of love, a spirit of togetherness, and a spirit of recognizing that if we all do our part, Bermuda will be just fine. Let's just get through this together, Bermuda, and I hope that you all have a very good night with your families. Take care.